We feel that up to 60% of uterine cancers are preventable. Why is this? Because we know that while living with obesity or living with overweight is a significant risk factor for a number of cancers, in fact, the correlation with uterine cancers, it is the highest risk factor and risk association. My name is Yoland Antill. I'm a clinician researcher. I am one of the directors of the Australia-New Zealand Gynaecology Oncology group, known as ANZGOG. And we have commissioned a report into the state of uterine cancers in Australia and New Zealand. And I am a co-lead of that report. I'm a medical oncologist. I'm also a cancer geneticist. I work across both public appointments and private appointments. And as a researcher, I am supported by Monash University. Uterine cancers are mostly made up of endometrial cancers. They make up around 95% of all uterine cancers, with the residual 5% being related to uterine sarcomas. And the risk factors include reproductive factors, genetic factors, both mutations or pathogenic variants in single genes, but also perhaps in collective genes known as polygenic risk, and also, very importantly, lifestyle factors and medical history factors. Globally, we have seen an increase in uterine cancers reported, but we don't have an understanding of what that means in Australia. We know that around the world, incidence has doubled in the last 25 years. So our report has similarly found an alarming continued increase over the past 25 years, but the projected increase of incidence in uterine cancers is alarming, particularly in women under 50 years of age. While ordinarily this has been thought to be a disease affecting women of older age, our fastest growing groups are in fact in the 35 to 45 and in fact the 25 to 35-year-old age groups, from up to 75% increase projected in the next decade. And what that has translated to is equally an increase in mortality relating to uterine cancers over the last 25 years and is projected to continue to increase over the next decade. So in Australia, at the current time, approximately 10 women are diagnosed each day with uterine cancers, and approximately 2 women will die each day from that disease. If we think that in the next decade this could increase by up to 150%, then those figures will continue to rise accordingly. We've also found that uterine cancers is not an equitable disease. There are 3 significant gaps in our community that we've found as a part of this report. Women of First Nations origin, women who live in regional and rural Australia, women who are of lower socioeconomic income, have both poorer outcomes, increasing mortality, and are diagnosed at a later stage than women who are of non-First Nations origins, who live in urban areas and have higher financial opportunities. And that is not fair. Why should where you choose to live, your financial income status, or your ethnic origin have an inference in whether you are diagnosed at an opportunistic time and ultimately your overall outcomes of a diagnosis from uterine cancer? We have also discovered that there is very little awareness around uterine cancers in Australia. In one study, 95% of women who were interviewed had never heard of uterine cancers, are not aware of this being a cancer potential. And often in my own practice, women come to me never having understood that uterine cancers were something that they could be at risk for. With the predicted increase in incidence, we have projected some financial impacts to Australia in the coming decade. Alarmingly, the total potential predicted costs to Australia in the next decade of uterine cancers alone is equal to $26 billion. This is made up of several factors. This is equating to years of life lost, the impact of living life with a disability, the burden of loss of partner and of mother, the direct healthcare costs of relating to the treatments of uterine cancers, and then also, of course, the impacts to the workforce itself. But $26 billion to a country with a population as small as Australia is a really quite shocking understanding and projected figure. So we feel this should be a critical national priority, and as such have created 5 strategies to aim for over the next coming years. This includes the concept of halving the incidence going forward. We anticipate that up to 60% of uterine cancers are preventable, and we would like to eliminate the inequities around uterine cancers in terms of later diagnosis, the access to gynaecological specialist cancer care, and specialised care for all women, which includes precision care, access to molecular sequencing to understand molecular subtype, to enable targeted treatments for our patients with uterine cancers. We want to be able to support every woman, both at diagnosis, during her treatments, but importantly in the long term. A community-based organisation to both raise awareness and increase advocacy for women and increasing the support is a critical part of our national strategy. But first and foremost, ANZGOG is a research collaborative organisation. And so our number one strategic plan from ANZGOG's perspective is to consider what are the research and data priorities for the next decade. And this we can't do alone. We need to partner with government, we need to partner with non-government organisations, we need to partner with community in order to facilitate the best way forward in research to improve outcomes for our women diagnosed with or at risk for uterine cancers. We feel that up to 60% of uterine cancers are preventable. Why is this? Because we know that while living with obesity or living with overweight is a significant risk factor for a number of cancers, in fact, the correlation with uterine cancers, it is the highest risk factor and risk association. We know that in Australia, the proportion of the population who are living with overweight or living with obesity has increased enormously over the last decade and is projected to increase over the coming decade or 25 years. In particular, the proportion of younger women, so women under 50 who are living with overweight or living with obesity, has substantially increased over the last decade. And we feel this is one of the major contributing factors to the increasing incidence and the projected increase in incidence in uterine cancers in our younger women. If we don't take this as a national priority, we predict that in the coming decade alone, approximately 44,000 new cases of uterine cancers will occur, and that translates to almost 9,000 women dying from uterine cancer-related disease.